Hi there, I'm Amanda. I'm going to be your nurse today. I'm going to wash my hands. Can you verify your name and date of birth?
Aaron White, 8/12/91.
Okay. Is it okay if I do an assessment on you for your cranial nerves, your eyes, ears, nose, and throat? Okay. Do you have any vision problems?
No.
No issues seeing?
No.
Any hearing problems?
No.
Any issues?
No.
Any issues with smelling?
No.
Or your throat?
No. No.
Okay. Alright, so the first thing that I'm going to check is your olfactory nerve and your cranial nerve number 1. So what I'm going to have you do is close your eyes. I'm going to have you see if you can smell this. Close your eyes. Okay, can you smell it over here?
Yep.
Can you smell on this side?
Yep.
Okay. Alright, I'm going to close this nostril. Sorry. I'm going to close this nostril. Alright, blow out this side. Okay, blow out the other side. Any issues there? Okay, you're able to smell? Tell me which side it's on.
That's on the left side.
What about now?
That'd be on the right side.
Okay, but you're able to smell?
Mm-hmm.
Okay, so the next one I'm going to check is your optic nerve, which is your cranial nerve number 2. Alright, you can open your eyes. So we're going to do the Snellen eye chart. We're going to hold it about 14 inches from your face. Okay, I'm going to have you cover one eye. Okay, read the smallest line you can see.
XOO 41 25 2025.
Where?
XOO 41
Oh,
2025.
you normally start at the beginning. Okay, so that eye is 2030. Alright, cover your other eye. Okay, smallest you can read.
428365 WEM OXO 63 2045.
Okay, that shows. Which one are you reading?
42836M.
Okay, that shows your 2040. Okay, good. Okay, the next thing that I'm going to check is your cranial nerves 3, 4, and 6, which is your oculomotor. So I'm going to have you look at my finger and follow my finger. Okay. Okay, so you're able to do that. That is the 6 cardinal movements. Everything looks good there. I'm going to next check, have you look at my finger and focus on it as I go in and out. Okay, good. Alright, so I'm going to have you close your eyes for me. I'm going to check your cranial number 5, your trigeminal. So I'm going to have you close your eyes. Okay, can you open your mouth for me? Okay, good. Alright. Okay, the next one I'm going to check is your facial. Oh, actually, while your eyes are closed, tell me where you feel me touching at, okay?
On my forehead.
Yep.
My chin. Cheek.
Okay, good. Alright, the next thing I'm going to check is, it's probably going to be your favorite. I'm going to check facial nerves. Well, actually, it'll be after this one. Let me check your facial nerves. Okay, so smile real big. Okay, squint your eyes really tight. Okay, puff your cheeks out. Okay, good. Okay, so I'm going to check your, next your acoustic. So I'm going to cover one ear. You can open your eyes. I'm going to cover one ear and I'm going to whisper. You tell me if you hear anything.
Yeah.
Okay, you cover this other side. Okay, you still able to hear anything or everything?
Yeah.
Okay, so the next is going to be your glossopharyngeal. So I'm going to have you open your mouth real wide, stick your tongue out, say ah. Okay, everything looks good there. That's cranial nerve number 9. Okay, next I'm going to check cranial nerve number 10, which is your vagus nerve. Alright, so I'm going to have you stick your tongue out. Look up some for me. I'm sorry. I knew you'd like that one. Oh, goodness. Okay. Goodness. So the next thing I'm going to do, back with the acoustic, I'm going to go back to that one. So this is the Weber-Renee test. So what I'm going to do is I'm going to hit it on my elbow, and I want you to tell me if you hear it on both sides, okay? Do you feel it on both sides?
No, I don't feel nothing.
You don't feel it? You don't hear the vibration?
No. I do now.
The right and left?
No, it's about in the middle.
Okay, but are you able to feel it?
Yeah, on my head.
Okay. Can you tell me if you feel it over here?
Yeah.
Do you feel it more that way?
Yeah.
When I put it on your mandibular joint? Or do you hear it?
I hear it.
Feel it?
It quit working. Yeah.
See if we can get it together.
Yeah, now I hear it.
Let me try this side.
Now I hear it.
Okay. stronger whenever I put it here
Uh-huh.
than when you could hear it?
Yeah.
No? Okay. Alright, so everything works there. Okay. Okay, so next I'm going to check your vision. Okay? So I'm going to check for your red reflexes. So what I'm going to do is I'm going to dial this to 0. Okay? Alright, if you'll just look up here at me. Okay? Other side. Okay? And I'm going to dial it up to 10. Okay, so now I'm going to get a little closer. Okay, so now I'm going to check your retina. I'm just looking for any blood vessels in the back. Just look in the back of your eye. Just look straight ahead. Okay, everything looks normal in there. I'm able to see that your pupils are equal, round, reactive to light. No issues there, no vision problems.
Mm-mm.
Okay, I'm going to change this and I'm going to put on the earpiece. Okay, and I'm going to look in your ears. A little attachment. Okay, all right. Okay, so the first thing I'm going to look for is any buildup, any wax. Everything looks good. No redness, no soreness, anything like that.
Mm-mm.
Let me check your other ear. Okay. No redness, no wax buildup. Looks like you're pretty good at cleaning your ears. Any issues?
No.
Okay, let me look at your eardrum real quick in here. Okay, this one. Alright, your eardrums even look good and clean. Relax, clean ears. Oh, let me look at your nose. Okay, so I'm gonna have you look up. I'm gonna have you look up, okay? Up there. Okay, just hair, pink. Nothing in the nose, no difficulty breathing. You don't look like you have like a deviated septum, nothing like that. You snore a lot at night?
I've been told I have.
Yeah, okay, but no breathing issues other than that?
No.
Okay. Do you have any questions about anything?
Mm-mm.
Okay. Well, thank you for letting me do this assessment on your cranial nerves, your eyes, ears, nose, and throat.